And welcome, everyone. My name is Susan Wilburn, the International Sustainability Director for Healthcare Without Harm, and I'm delighted to be with you and excited to present the new Global Green and Healthy Hospitals Practice Greenhealth Sustainable Procurement in Healthcare Guide. I'm really happy to have you with us and want to thank you for joining us today. We owe a great deal of thanks to the colleagues who contributed to the guide, and especially my colleague, Beth Eckl, the Director of Environmentally Preferable Practice for Practice Greenhealth, for her leadership in the development and collaboration to achieve this important work. Beth will speak later today on the second edition of the introduction to the guide in the American and European time zones. Good afternoon and good evening to many of you in Asia Pacific and Southeast Asian regions of the country. For this particular session, we had registrants from over 35 countries that included the Americas, Europe, Africa, Asia Pacific, and Southeast Asia. So welcome to all of you, which means that some of you are up in the middle of the night to join us. And I wish you, hope that we keep your interest as we move forward. This is the Sustainable Procurement and Healthcare Guide is a guide of the Global Green and Healthy Hospitals Network and a benefit for membership in the network. At the end of the session, I will welcome you again to join the GGHH network if you're not already a member. You can see on the map on this slide that we have 1,377 members in 72 countries that represent over 45,000 hospitals and health facilities. And on this map, you can see where the members are and what countries are represented. They're in color. You can also see in red stars where our 3 regional offices are, near Brussels in Belgium, where the European Commission is, near Washington, D.C. in the United States, and Manila in the Philippines. And then the red dots signify our strategic partners where we have office and colleagues that we work together to achieve these goals of the Global Green and Healthy Hospitals for sustainable healthcare practices. Thinking about the GGHH goals, we have a 10-goal agenda, which you can see on the slide, and I have put this slide to match the goals with the UN Sustainable Development Goals, which were adopted in 2015. And I particularly highlighted here on the slides the 3 goals of SDG 3 on health and well-being, SDG 13 on climate action, and SDG 12, which is the goal for sustainable production and consumption, where sustainable procurement and the sustainable public procurement programs lie. Here's a quote from one of our members in South Africa about the importance of the guide to their work, not only to assist them in reducing the cost of products within hospitals, but also a groundbreaker in preventing occupational injuries sustained by workers, as well as reducing greenhouse gas emissions or carbon footprint of health services. I'm going to talk and lead you through the introduction to the guide before I introduce our speakers. Now, what is sustainable procurement? Defined as preventative medicine that supports a high-performance healing environment, attracts new opportunities, models leadership values to communities, patients, and employees, and can save your organization money. And as I mentioned, Beth is the Director of EPP, or Environmentally Preferable Purchasing, while sustainable procurement, as you'll see in a minute, goes beyond environmental sustainability. It's often called EPP. And there are many reasons why we need to engage and be active as a sector in sustainable procurement, not the least of which you see on the screen is that many products that we use in healthcare settings are hazardous. And they may be therapeutic for the care of patients, but they're hazardous for others to be exposed. They are carcinogens, and expose communities, staff, and patients to harm. We know that the health sector represents almost 5% of global greenhouse gas emissions, of which the supply chain contributes more than 70%. So our efforts to reduce greenhouse gas emissions in healthcare activities has to be addressed through supply chain. We're also the second largest user of energy and water among commercial buildings and have many products and packaging that is thrown away, generating solid waste and challenges in the disposal. Now I'd like to introduce our two speakers. We will start with the Director of Environmentally Preferable Procurement at Practice Greenhealth. As I mentioned before, Beth has been the partner in the development of the guide and will be introducing it. In her work as EPP Director, she provides technical support, consulting services, and training on sustainable procurement for health systems and healthcare facilities. She will be followed by Dr. Akash Shrivastava, who is the Joint Director and Head of the National Center for Disease Control of the Ministry of Health and Family Welfare of the Government of India. Dr. Akash is the Joint Director for the Center for Environmental and Occupational Health, Climate Change and Health at the National Center for Disease Control, NCDC, and his team supports the Health Ministry on environment and climate related to health matters, and also implements the National Program on Climate Change and Human Health. This National Health Program envisions bringing about greening in the Indian health sector. Prior to joining NCDC, he has worked in various capacities with the Indian Council of Medical Research and with UNICEF. He's a medical doctor, passionate about public health, and has a master's in public health with a PhD in epidemiology from University College Dublin in Ireland. Welcome, Dr. Akash. He will be followed by Charlotta Brask, who's the Director of Sustainability for Region Stockholm in Sweden. Charlotta has worked with sustainability issues within the health and public transport sector for 18 years. She holds a master's degree in analytic chemistry from Lund University, and her responsibilities include to develop, manage, and monitor climate, environment, social sustainability, and human rights issues in Region Stockholm, which has reduced its climate footprint by 70% since 1990. Region Stockholm and the country of Sweden as a whole have been pioneers in sustainable procurement and work to advance this area to establish and follow up on environmental criteria, working conditions, and human rights. We are so delighted to be able to work together with Region Stockholm. Mr. Pankaj Bector, who's a procurement specialist within the NCDC, the National Center for Disease Control, which, as you know, is part of the Ministry of Health and Family Welfare for the Government of India. He's a senior procurement specialist with more than 33 years of experience handling medical stores. And as a procurement head for over 20 years, he's responsible for the management and complete end-to-end procurement of goods, which includes making regular procurement plans, compilation of demands with specifications, floating tenders, finalization of techno-commercial bids, placement of orders, receipt of items, and their satisfactory utilization. He holds various degrees, including a master's in pharmacy and business management, and is an active member of the Indian Pharmaceutical Society. He's the General Secretary of the Indian Hospitals Pharmacy Association and Central Executive Council member of the Indian Pharmaceutical Congress Association. Thank you, Mr. Bector. We look forward to hearing from you and from working together in the future, benefiting from your great experience. Dr. Hervé Nirjanya Megareza, who is the Operational Director of the Cahaya Kalbu Clinic in Bandung District in West Java. Before she took on, Dr. Hervé is a medical doctor, and prior to becoming the Operational Director of the Cahaya Kalbu Clinic, she was an emergency room doctor at the Tanjung Pinang Government Hospital in Riau Island, also in Indonesia. As you will hear, she is very passionate about integrating sustainability within health systems and has taken various initiatives within her health center as well. The second speaker that I will introduce now and who will follow Dr. Hervey is Manjula Sickler. Manjula is the Sustainability Manager for the Auckland District Health Board in New Zealand. She has worked in the health sector for 18 years with extensive experience in finance, business development, project management, and now leads the Auckland District Health Board Sustainability Program. Under Manjula's leadership, the District Health Board is ranked highly for its sustainability program, being one of the most forward-thinking and innovative healthcare organizations in New Zealand. Not only New Zealand, and throughout Asia Pacific and globally. She's currently focusing on implementing the UN Sustainable Development Goals throughout the organization, and she's also served on the advisory committee for the Sustainable Procurement Index for Health. With that, I'm going to turn the ball and the microphone over to Beth Eckl, who will spend the next 10 to 15 minutes introducing us to the guide, which will be followed by the speakers providing case studies about their implementation. Thank you and welcome, Beth.
Great. Thank you, Susan. Hi, everybody. I want to just take a few moments to, as Susan said, describe the resources in our guide. No matter where you are in sustainable procurement, the guide will help you develop your program or expand your existing program. And you're going to find answers to key questions in this guide, such as, why is sustainable procurement important? And I'm going to share a couple of resources with you as well. First, I want to make sure that it's clear what the sustainable procurement considerations are. There are 3 pillars in sustainable procurement, and it's usual that the environmental considerations have been a part of the consideration in the past, especially through environmentally preferable purchasing. Social and economic considerations are now a part of sustainable procurement, and social considerations include diverse suppliers, human rights, and fair wages. Economic considerations include things like the use of local suppliers and cost savings and looking at the total cost of ownership. And then, of course, the environmental considerations are a part of that as well. And so all 3 of those make up the sustainable procurement considerations that you want to factor into procurement. Our guide is actually structured by a plan, do, check, act cycle. That cycle well, plan, do, check, act is a quality improvement process that's common in healthcare, and it helps you to build and assess the elements of a program. I'd like to showcase this table because this shares the 10 key elements of a successful sustainable procurement program. In the first one, the sustainable procurement strategy, and the second, an action plan, these are 2 of the key elements, and the guide highlights a work plan to help you with that element. The third one, the high impact procurement opportunities list, the guide also shares a sample of products for you to consider in healthcare. The fourth, the sustainable procurement policy. There's also a model policy for you to utilize. Standard operating procedures, tools, training, and communications are additional elements that should be included in a sustainable procurement program, and the guide outlines guidance as well as case examples for you to utilize. Another is supplier engagement strategies, and we've heard from many users how important this is and how important it is to initiate early in the procurement process and to continue that. And there are two other elements that are important to consider in the check and the act cycle, and one is tracking and monitoring, and the final one is reporting, to report your success in your program and share it both internally and externally with others. The guide also identifies several tools and resources through annexes. For example, Annex 4, as I've pointed out before, is a sample high-impact procurement opportunities list that organizations can use to identify priorities for purchasing, because we know that there are hundreds of contracts and thousands of items that a hospital can purchase. It's important to prioritize which ones to target. Also, another tool is a model sustainable procurement policy in Annex 5, and that is also there to help support you develop your own policy. Another tool is in Annex 2. It's the organizational self-assessment checklist. And this helps you measure progress in achieving key program elements of those 10 key elements that I highlighted earlier. There's also a chart that highlights where to go in the guide for specific needs, such as how to set sustainability goals or how to engage with suppliers. In the chapters of the guide are steps to implement sustainable procurement, and in each chapter, the steps are highlighted first, and the chapters are structured to follow those steps to keep it simple for you to learn all the various steps to implement. For example, in Chapter 2, in the planning part of the cycle, there are 4 implementation steps. The first step is to assess the current state of a program, and as part of that, the guide has a self-assessment checklist to support you in that effort. Another step is to build support with leadership. And again, the guide provides case examples and other materials to support you in establishing support with leadership. Another step would be to develop strategies, action plan, and goals. And again, there's guidance and case examples to support you. And the final step in Chapter 2 is to develop high-impact procurement opportunities list. And there is a framework to help you prioritize that's provided in the guide, as well as a sample list. You will also find a framework to embed sustainability in a procurement cycle. And this slide shows you a very simplified cycle. You know, the pre-purchasing stage is the work done before the proposals come back from suppliers. And here you can identify sustainability criteria in this stage. The purchasing stage is the work to evaluate bid proposals. And here you would include sustainability in the scoring and assessment of the proposals, the same as you would with quality and cost. And then lastly, the post-purchasing. And the post-purchasing is when you would award and manage the contract. And here sustainability would be a part of ensuring the supplier meets the sustainability terms, as well as holding them accountable for meeting sustainability goals, and you can hold them accountable during business review meetings. The guide also recommends a protocol when you're identifying sustainability criteria, and we know this is always a challenge to do, so the guide is trying to simplify this part, simplifying how to identify sustainability criteria. And we've done so. The guide outlines 4 steps that you can take. The first step would be to refer to existing healthcare without harm criteria that's available through the websites and through various links in the guide. If no criteria is available, there are also various reputable third-party labels, such as Blue Angel in Germany or EU Eco-Label in Europe, that you could refer to that are also linked through the guide, and there are lists available. If none of those are available, then another step would be to use standardized environmental criteria. And we have created some standardized environmental criteria to support standardizing the considerations that are used in healthcare. And this particular resource highlights 2 considerations overall, and one is chemicals of concern and the other is waste reduction. This criteria aligns with Kaiser Permanente's EPP standard that has been in use since 2017, and then there's some earlier versions of this work that were done in 2011. So the supplier community is familiar with this criteria, so this is something that you can use should you not have resources in Step 1 or Step 2. And if that is not appropriate for the product that you're reviewing, then conducting your own research would follow, and there are resources in Annex 7. There's a typo on this slide, but it's Annex 7. So overall, the guide provides a step-by-step approach, various case examples to support you, as well as multiple tools and resources to help your organization either launch a program, a sustainable procurement program, or to advance an existing one. So we hope you find it useful.
Thank you very much, Beth. Before I turn the ball and the microphone over to Dr. Eckl Srivastava, I would like to invite you to ask questions in the Q&A or in the chat box. We will have time at the end of the 3 speakers for questions. So again, welcome, Dr. Eckl Srivastava.
All right.
Over to you.
Good evening, everyone. It's a pleasant opportunity for me to interact with professionals who believe in the principles of the green and environmental friendly healthcare from so many continents and countries. Myself and Mr. Pankaj Bector, we both are from the National Center of Disease Control in India, and I will be taking you all through what are some of the important policies that we have of establishment of a program, and more details will be taken by Mr. Pankaj Bector in a subsequent presentation. So that's a brief of the India's climate change and health policy. India's climate change policy came under the Prime Minister's Council on Climate Change, which had a number of missions to support the policies in relation to climate change. But fortunately, after some critical decisions, in January 2015, a new mission, the so-called the Health Mission, was supposed to be included under the Prime Minister's Council on Climate Change. The Ministry of Health is the nodal ministry looking into this health mission, and we at the National Center of Disease Control are the technical agency that's supporting the ministry in implementation of the health mission goals and visions. We developed a National Action Plan on Climate Change and Human Health, which was approved the previous year at the Prime Minister's office. Next slide, please. So, in the health mission, we have a vision to take together with us all the states and union territories of the country to implement the objectives that we have undertaken under the mission, and the funding to implement this mission activities is through the National Health Mission, which is an umbrella program which overlooks all health programs for the country. The National Health Mission Steering Group had approved for implementation of the Climate Change and Health Program in February 2019, and our goal is to build a climate resilient health sector in India for all the states and union territories. So among the specific objectives that we have, the most important objective that is relevant to today's context is strengthening the capacity of the healthcare system, developing the health action plans, including the greening of the health sector. To begin with, as of now, we are in the process of policy decisions and the process of establishing the principles. As we heard in the previous presentation, it's important to agree upon to the principles. We have a so-called an Indian Public Health Standards. It's a standards that define how the healthcare facilities will be built in the country, in the rural India, in the secondary and below secondary level hospitals. And so far we have made a great success in trying to put in the greening principles in the Indian Public Health Standards, and we look forward to getting accepted other issues that we have around sustainable procurement policies, developing a broader vision document and implementing activities. Well, among the other objectives of this program is to create awareness, strengthen preparedness, develop partnerships, and of course research and development. Okay, so why to create a sustainable policy under the National Program on Climate Change and Human Health is because this program envisions to reduce the environmental footprint and to promote a public and an environment health. So we are planning to have a vision document, a so-called, we will call it a Green Book NCDC, which will set an example so that we at ours first become a green in concept, in practice, and then are able to take our examples to the rest of the country. We plan to signal commitment from the highest levels, from the ministry and its technical agency, the National Center of Disease Control, on principles of sustainable procurement policy, which is about green procurement, providing a consistent approach, which is to be agreed by the procurement cell for appropriate technical specifications and bid evaluations, to ensure sustainable procurement is regularly monitored, and to link sustainable procurement that we envision at NCDC eventually to other states and union territories under the National Program of Climate Change and human health, and acknowledging the sustainable procurement performance, that the sustainable procurement provided by the states and the UTs under the NPCCHH is properly acknowledged, and they are provided incentives to undertake such procurement incentives. Thank you.
Okay. Very inspiring leadership from the National Committee on Climate Change and Health, and we look forward to working further with you together. With that, I would like to welcome Charlotta Brask from the region Stockholm in Sweden. Welcome, Charlotta.
Hi, good evening, morning, and everything, and thank you, Susan, for the introduction. Today I'm going to give you some examples of how we reach our sustainability goals and ambitions through procurement. Region Stockholm provides healthcare services, public transport, regional planning and culture for the greater Stockholm area, serving 2.3 million citizens. We have 6 emergency hospitals with 2,800 beds, and we have 38,000 employees working within the healthcare sector. So where do you start in order to achieve a sustainable procurement process? As stated in the Healthcare Without Harm Sustainability Procurement Guide, it is important to have clear and ambitious directives from the policymakers. Our environmental program for the period 17 to 21 states that we will continue to reduce our climate impact from public transportation and healthcare, including the climate impact from construction and civil engineering projects, and also including consumption and production. In addition to the environmental program, we also have a phase-out list focusing on minimizing the environmental and health impacts from hazardous chemicals and pharmaceuticals. And since 2006, the healthcare and laboratory services within Region Stockholm has reduced the volume of hazardous chemicals by 90%. We also have a code of conduct for suppliers, and we've had that since 2008. And there we include environment, human rights, workers' rights, and anti-corruption. And that is from the raw material all the way up in the supply chain, plus environmental issues in the user phase. So what have we achieved through our policies and procurement criteria? You see a graph here. The y-axis shows our emissions of carbon dioxide equivalent. In 1990, they were nearly 400,000 tons. In the scope of the measurements are public transport, other transportation, and travel linked to healthcare. It's also the running of the real estate. It's heating, cooling, electricity, and different medical gases. And we've already managed to reduce the greenhouse gas by 70% since 90, as Susan talked about before. And since 2011, we have reduced with 45%. And the reduction is primarily due to rapid rise of the number of clean vehicles, an increase of renewable fuels in all operations. From 2018, the bus service is run on 100% renewable fuels by volume, the trains on 100% renewable electricity, and our buildings run on 96% renewable energy for cooling, heating, and electricity. And this has been made by putting up environmental criteria in the procurement of energy to our transportation, buildings, and all our services. So in order to know that you use the right criteria, it is important to follow the supply chains of your product and also find the largest risks regarding human rights and environmental aspects. And then you address them in your requirements. It could be raw material extraction, manufacturing, transport, sterilization, grinding, and recycling. You don't have to look in detail in this picture. For some is in Swedish, but this is a flow picture when we look upon the different aspects from scissors. It's from plastic scissors to multiple scissors in steel and disposable scissors in steel. But when you see this picture, it's easy to understand that your purchases have a global impact, but also that there is a security and asset aspect linked to a purchase of products for the healthcare. It's also obvious that we, the buyers, the healthcare sector, buy from the same suppliers in the same chain. So you need to build knowledge about the sustainability impact of your product, and that's what we are trying to do. We have, for example, looked at surgical gowns and found out that disposables have an 11 times larger climate impact than multiple clothing. And the multiple clothing is used 83 times before being discarded. We have also looked into another product that's used in vast amounts in the healthcare sector, and that's the aprons. And some products we need to use, and that's what we can do is to make sure that the products we use have as little impact as possible, and then bio-based is a good alternative. So by communicating our ambitions, our objects in dialogues with the suppliers and introducing, asking for bio-based material, we now have bio-based aprons in our services, and they have 3 times less climate impact. And it's also inspiring for the people working, for example, in the dental care to know that you have a product that has less impact on the environment. So another important step, as described in the guide, is to do the follow-up and monitoring. But there is not enough time for me to talk about that today. But in my presentation, there is a link to more information about our last follow-up report that you can read. So now I'm going to move over to a very current product. Approximately 65% of the gloves used in the healthcare sector are produced in Malaysia. And there are long-known risks regarding human rights linked to the production of gloves. During 2018 and 19, Region Stockholm, together with other regions, have performed factory audits which confirmed that there was a forced labor in the factories producing gloves. It became obvious for us that we needed new ways to address the risks, and we needed to act. We wanted to make the suppliers show their work regarding human rights, and also we wanted to reward those who do right. So what we did was that we updated our criteria and also how we apply the criteria. So our new contract for surgical gloves came into force the 1st of April. And in this procurement, we applied mandatory requirements that the suppliers needed to verify at the bidding, in the bidding phase. So we asked for where the products are produced, the actual address of the factories. We also asked for if there is a monitoring process, how does it look like. We asked for percentage of migrant workers, and that was in order to understand possible risks of recruitment fees. We also made the factory, we stated that they need to have a policy that it at least makes a commitment to not withhold ID documents, that they pay for all fees related to hiring and actively monitor via interviews in the beginning of the hirements and at the end, that the workers are not in a debt situation to recruiters. And we also made them show if they have a plan to enforce the policies they have. So out of 3 tenders, only 2 could meet requirements, and 1 of the suppliers could not meet the requirements. And the tender not meeting the requirements, they could not show that they had a monitoring process at factory level and lacked a plan to enforce policy at factory level. But we also, in addition, social criteria was applied as award criteria, such as if the supplier could show results of risk assessments and known risks, and also that they needed to show that they have formed a code of conduct audit by independent third party according to relevant standards and not older than 2 years. 2 tenders within DM meet both the mandatory and the award criteria. So what we are trying to do here is that we move from only applying social criteria in the contract terms. We move to evaluating, making the supplier show earlier in the process to verify how they meet mandatory requirements, and also by award criteria, rewarding the suppliers that spend resources to mitigate these risks. And I believe as a large public body, Region Stockholm has possibilities, but also responsibilities to set environmental and social criteria and standards, and also encourage new innovations, influence other organizations. And sustainable criteria in procurement can actually drive the market through product development, increased working and living conditions globally where products are produced. And all the regions in Sweden, we work together to address social and environmental responsibility in the delivery chains. And together we consume goods and services of approximately 13 billion euros. So this is a start, but what if all the healthcare organizations in Europe and all over the world got together and put up criteria like this? We would have a really strong purchasing power together. So thank you. Thanks for listening. That was my last slide.
Thank you very much, Charlotta. What you've demonstrated is how complex our supply chains are, the challenge of setting sustainability criteria and holding to them, and the great impact when we collaborate and work together to improve public health and working conditions for health workers, whether they're producing or using or disposing of our products around the globe. Again, a reminder that if you have questions, we should have time at the end. And again, thank you, Charlotta Brask. Our last speaker will be Mr. Pankaj Bector.
Good afternoon, good evening.
Mr. Bector.
And namaskar to all the participants of the webinar. I'm thankful to Dr. Purnima, to PHFI, and Suzanne. I met her 2 years back, and they made me a part of this very team of green procurement and green revolution. So I'm really being thankful. Let me start with the topic that how sustainable the procurement leads to savings within the health system. We all know that the health sector itself is paradoxically making a significant contribution to the climate change, as already being explained by Suzanne. And the document of Healthcare Without Harm, which I have gone through 2 years back, is quite elaborative. And it clearly shows that health sector is the 5th largest emitter for the carbon footprint. And the top 10 countries, they account about 75% of the healthcare's global climate footprint, like the USA, China, and European region. And 71% of the healthcare's global climate footprint is attributed to its supply chain, including the production, packaging, and transportation. So this is how it has become so important that the sustainable procurement has really taken a front seat. Why sustainable procurement? And I have also taken 2 of these, not exactly the studies, we have taken two products in procurement that we will take care of while procuring those products, and we will also try to replace that, like we have replaced around 70% of the CFL with the LEDs last year, and since ours is a place where we have got heritage buildings and we can't do much with the heritage structures, but we do put some solar panels over there, and of approximately 120 kilowatts in last 1.5 years. And we have also ensured that there must be a better patient, employee, and community health. And for this, we have strictly adhering to the biomedical waste rules and regulations being governed by Central Pollution Control Board in India and NPCCCHH. And the different bins, the colors which have been mentioned. The latest what we have introduced is putting barcoding on those color bags. Once those color bags will be barcoded right from the place from where they are picking up those bags till their disposal, if there are any deficiencies, then immediately the regulatory bodies, they came into action and they issues notices to them. And we are also having a value system for strategic suppliers. In India right now for the last 2 years with the present government who is taking drastic and very positive steps in procurement, there is a global government e-marketing which has been started, which I'll explain in my subsequent slide. And with all those efforts putting ETP, STP at place, and all these bins and all the barcoding, we are ensuring that the patients and the healthcare professions' health has been taken care of. Now the implementation of the sustainable procurement. This is again a very important part, like Dr. Akash has already explained that we are planning to have a green book, a green document, which we are planning to release by January 2021. And the committee will be consisting of either the director will chair Dr. Sujit Singh is a very renowned public health specialist and a very dynamic leader, and it will be co-chaired by Dr. Akash or the head of the environment division. And as already explained in the previous slides in the beginning by Beth also, that the plan, do, check, and act cycle has been taken care of. In last 1 year, after sending my presentation to Singapore, we have planned to remove the PVC gloves with the non-PVC one, and we have succeeded in that. In last year, the COVID was a challenge for us because at that time there was acute shortage. But otherwise, we have replaced the PVC gloves with the non-PVC one. The CFL replacement with LED has already been completed around 60% or so. But since January, there is a COVID pressure and nothing else except NCDC is doing those COVID testings only. And this is the reason that we are not being able to complete it. But I think there is every likelihood by 2021 we will be able to completely phase out these things. Regarding renewable energy, we have put around 120 kilo capacity solar panels, and there is a saving. Let me share it here only that there is a saving of around 2.4 million INR, or say $33,000 annually. The electricity bill has gone down with the implementation of or just installing those renewable or solar panels over there. And we are also in a process of replacing sodium hypochlorite, which is a challenge because presently with the sanitization of the buildings and sanitization of all those health centers, the sodium hypochlorite was really being there in demand. So, but we are there in discussion with our lab people so that we can, to some extent, can replace it timely. Regarding hand sanitizers, what we are using presently, there is no triclosan, and we are ensuring that the said component should not be there in our further procurements also. Regarding barcodes, I have already explained that we have just taken the approval rather yesterday only, and by September only we will be able to implement the barcoding on all our biomedical waste bags which are being lifted from NCDC to the disposal site. Regarding domestic manufacturers, this is also again, like I've explained, that the present regime of the government e-market is there, that is GEM, where they've got a policy of promoting the local manufacturers and promoting the small, medium, and micro manufacturing. And this GEM has got around, say, 500,000 vendors on its registration. And they have got around 1.4 million products or services. And it works like Amazon and Flipkart, and the procurements are there for government sector only, for states and for the union territories which are under the central's control. Regarding NCDC self-assessment checklist, I have again taken the lead from the Sustainable Procurement in Healthcare Guide only. And the present book, what we are planning, the green document, this will explain the sustainable procurement strategy. We will take care of the mission, NCDC mission, and the sustainability commitments will take a priority in this. And the plan will include, because this green book, what we are planning to have, this will be an initial document, a preliminary document, and a Bible for us. Then once it is out, once it is there in public domain, and once it is there being released, only then we will have our future plannings and commitments over there. And we will also include, since we have already taken the gloves and sodium hypochlorite and some other products into consideration, but once this green book will give us the final direction of including some more high impact opportunist list items into this. And once this green document is there, then it will explain all. It will explain the sustainability checklist regarding the product specifications, the tender documents, the vendor's qualification is already being explained by Gaskar. Previous speaker has beautifully explained, and she has explained in length how the specification, how the suppliers' backend data has been checked. We will go by the regulations of this very country, whichever is feasible. We will try to include all those pre-qualification criteria and vendor qualification criteria in this. Regarding the training and communication, once the green book will be out, all the procurement committees, the technical specification committees, the bid evaluation committees, and the tender opening committees, they will be trained. They will be given the necessary support and guidelines how this green environment commitment can be achieved. And we will have a policy, because everything will be there in that very document only. We'll keep in place the tracking and the monitoring guidelines over there. And once we will have that very case, then we will present the case and we will report and share the same after evaluation with the other counterparts of healthcare without harm. The development of a sustainable procurement strategy and goals, as Dr. Akash has already explained, that we are planning to have that very book by January 2021, and we will include all our laboratory people, all our finance people, the policy makers from NCDC or from Ministry of Health if required, and there we will have our long-term vision for sustainable procurement. We will adhere to the SMART, the specific, measurable, achievable, realistic, and timely goals. And this, in fact, will only be clear once that document, once that green document with the help of PHFI and NCDC and Ministry of Health will be out, that all these systems, all these strategies, all these criteria will be there in place. Regarding embedding sustainability in procurement and pre-purchasing has already been explained by the previous speaker. I'll give an example that I have already given an example in my last presentation, where when we were procuring the computers for our laboratory people, then those functional but older computers, we have suggested them, rather than condemnation of those computers and disposing them off, we request them to shift those computers to the administrative division of NCDC, where they don't require a i7 or a i8 version, where they simply have to go into typing. So rather than disposing of those computers, we have given it to our other administrative divisions. Similarly, during COVID, there was another incident which I can share with the audience over here. Then there was a proposal regarding establishment of a control room. There was already having one control room in NCDC. Then there was a proposal of having another control room for 10 or 15 persons capacity. And the proposal was having a 15-person sitting capacity with all the caustics and all the flooring and then the workstations and then 10 or 15 computers. So a rough estimate at that time was given was around 8 million rupees, or you can say that around $100,000. And what we request after discussing the same, because the time was very short, we have been given a timeline of 72 hours only. So we have requested the authorities, since we have got some computers which are recently being phased out from our computer lab. So out of those 18 computers, we could utilize the 8 computers after minor repairs. We just bought them the new headphones, and the workstations which are already there in some of our buildings, we have shifted those workstations in the COVID control room. And you must appreciate that we have got it done in $300,000 rupees only. Or in dollars, I will say $3,750, around 3 lakh rupees in Indian rupees. So instead of spending around 8 million rupees, we have come down to just 3,000 rupees. And we could establish that very COVID control room with the items which are already available there with us. So similarly, identifying the sustainability criteria, we have to put all those guidelines at place so that once we will have the green book, once we'll have a document there with us, with the help of PHFI and taking the guidance from the Sustainable Procurement Healthcare Guide, we'll be able to have a clear-cut directions with us. And the standard specs will also be accordingly being modified, and the additional sustainability questions into the proposal will also be taken. And as already explained by the previous speakers, they have put elaborate conditions regarding the workers' conditions, how they have been hired. So if possible, since we have got a procurement agency and a procurement portal over there, so accordingly, whichever is possible, we'll go ahead with that. And regarding the evaluation of the proposal, then accordingly, depending upon the preconditions what we put in the tender document in the RFQ, we will evaluate the proposals accordingly. And we will also try to verify the suppliers' responses, because as I have already explained, the government e-market is in place, having a huge number of vendors already registered with them. We will try to push the authorities so that the same guidelines can also be passed on to them, so that we can accordingly go for the post-purchasing reviews also for finalizing and before award, or maybe the pre-qualification criteria and the registration of the suppliers can have those conditions, then the things will be a little easier. Thank you. Thanks a lot.
Thank you very much, Mr. Pankaj Bector. It is really interesting to see how you have already put the steps within the guide into practice, making the guide come to life in action. Thank you for the presentation. It also demonstrates how the cost savings that you shared in short time frames of 72 hours to prepare for a COVID control room demonstrates the collaboration and creativity in India to be able to implement sustainable procurement. We look forward to seeing the Green Guide as it is published and collaborating with you in supporting HELP members, the Health and Environment Leadership Platform in India, to implement those criteria. And with that, I will turn the ball and the microphone over to Dr. Hervin.
Okay, Susan, thank you. Thank you for the opportunity. Hello, and good day to everyone. I'm Dr. Hervey as a Director of Operation Cahaya Kalbu Clinic, Bandung, Indonesia. Today, I want to share to you about our primary consideration of our Sustainable Procurement Project at Cahaya Kalbu Clinic related with the topic, Role of Procurement in Creating Sustainable Healthcare Facilities. Okay. The sustainable procurement at Cahaya Kalbu Clinic is considered to be started since the heat of the COVID-19 pandemic at March 2020, and it changed our existing consuming linear behavior. Because as a primary healthcare service facilities, Cahaya Kalbu Clinic is doing the health services to the patients mostly as a curative part. So our health chain supply is implemented in a simple way. We are buying a product from the supplier, and then we use it in our daily routine activities. And after it has been used, the waste will be collected by our biomedical transporter, and we will buy another product again. But since the COVID pandemic-19, it was giving us an insight that we as a healthcare sectors doing a health services to the patients, but in other way, we also made a waste, produce a waste every day that coming higher day by day, moreover in a pandemic. And then we also use a chemical day by day in our daily use routine. So should we cure the patients and then do harm to communities and environmental? So there is a shifting in our organization mission that we want to achieve more healthcare resilience in the future. The linear supply chain, like we used to get it before, is made us very consumptive. So the procurement plan before is just considered based on availability of the products, the appropriate function of the product, and also, of course, affordable price. But if it is in the pandemic situation, it will be threatening our organizations. So the circular will be more acceptable as we can create our consumption to be more safer, and then we can make it more sustainable. So Cahaya Kalbu Clinic is started to begin its sustainable procurement project with the how we can determine the what kind of issue that we can put as the first goal as our sustainable procurement project based on its urgency needs of our clinic. So we choose the goals. The first goal is how to choose a standard and effective PPE for healthcare workers. As Susan said before, that sustainable procurement has to be considered based on three aspects: social, economy, and environment. Socially, working conditions in COVID-19 pandemic need safety work behaviors based on standard PPE. And there are embedded human rights to work in safe and healthy places. So we have to make sure we have a good self-protection before save the others. And we can have to promote health to communities that the message of COVID-19 can be prevented by proper PPE. So economically, we try to make a collaboration with a local confection to produce washable protection gown and try to replace our plastic apron with the mattress skin material. Like you can see and of your left side, there is an appearance of our nurse using washable protection gown and then the mattress skin apron material in an inpatient care unit. And in the right side, you can see our staff in emergency care unit and laboratory wearing a third level of PPE. And for the third level of PPE, we decided to choose a reusable coverall suit that is washable, and it can be washed for about 10 times per cycle. Actually, it has already has a license and also distribution permit and also standardization for our Ministry of Health of Indonesia. So we decided to use it to replace a single-use PPE. And at the end of the result, we can also reduce the waste, and economically, we can make an efficiency at saving our costs in case of disposal waste and purchasing. And then this is the cost comparison that washable coverall PPE can save 10 times lower in case of disposal cost and purchasing compared to the single use. And for the next consideration, we also trying to seek another safer chemical for our disinfectants. In line with the global vision first to do no harm, there is how we can to substitute the hazardous material. So the daily use of disinfectant agent should not exposing patients, staff, and community to harm. So we know that chemical is using every day in any daily various needs. So we try to elaborate the information, what kind of safer disinfectant we can find, especially in our district in Bandung. Based on many various reading resources, we find the chlorine dioxide, and it also has been produced by our local supplier. So we choose the chlorine dioxide to replace the chlorine-based chemical that we used before. For the information, actually, our clinic using many various of chemicals for hard surveys, flooring, room spray, hand sanitizer, and so on. And one that chlorine-based is reported in a few cases of respiratory irritation problem when it is applied as a hard surface disinfecting agent to our staff. So environmentally, it must be chlorine-free, environmentally friendly. As you can see at the next slide, this is the comparison between the chlorine-based and chlorine dioxide. That is saying that chlorine dioxide will not result environmentally dangerous chlorinated organics, and it has been classified as non-human carcinogenic effects like chlorine-based, and it is also need only lower concentration effective to kill microorganisms compared with the chlorine-based. So after the evaluation of 2 months running between April and May, after the re-standardization about what kind of chemical we want to use, that in May we can make an efficiency in a reducing of purchasing costs for about 12% lower. And after 3 months running with the 2 Sustainable Procurement project, for the next goal, we also want to up-level ourselves to be part of an occurring system to promote health to communities by bring a concept how can we reduce a plastic use at a pharmacy department. As we know, plastic waste is the largest amount of non-medical waste, and then we want to promote our government program at campaign movement for the Indonesian plastic bag diet. So we want to introduce the compostable bag made from cassava starch. So it is a smart innovation in the economic aspect that carrying local plant, that is cassava, that has been produced by our local supplier and already got an Eckl label certification. If you want to know what is the name of the cassava bag, you can search for a name of tallow bag. The cassava bag, environmentally, the waste itself can be reused multiple times and it can be decomposed, consumed by microorganisms without any pollution for about 6 months later, and it also can dissolve in hot water. With the first step is assessing its current positions through the aspect of consideration and trying to what kind of issue that can be put to the first place as our urgency needs to be implemented in our healthcare sectors. For Cahaya Kabu Clinic, it is choosing with the issue of reducing of PPE and also the looker for the safer chemicals. It is a need evaluation and a small evaluation. It has been reported that after the sustainable procurement consideration, we succeed to lowering amount and cost of disposal waste, and we can do the efficiency at choosing the variety of chemical disinfectants, also looking for the safer chemical for daily use. And then respiratory irritated health workers case reported due to chemical use is reduced. Sustainable staff to do innovation and then to collaborate with the others supplier, with the others partner of collaboration to get influence to the patient and get closer to the communities. So sustainable procurement is very useful to help us survive during the COVID-19 pandemic, not only because economically it is succeed to cost saving, but also socially to begin open opportunities to make further collaboration for more valuable healthcare services, and also for the environment because we can substitute the hazard material with the safer one. So I suggest you to have guidance in sustainable procurement to help the facilities understand and implement the program successfully, because I think if it works global, so the impact will work globally also to make greener and healthier in the future for saving our planet. I think like that from us, greeting from Cahaya Kalbu Clinic, Indonesia. Thank you, everyone. Thank you, Susan.
Thank you very much, Dr. Hervé. And I had the privilege of meeting Dr. Hervé in West Java a year ago in July at the Inception Workshop for Sustainable Procurement. And it is so impressive to see the advances that you have made in a year's time. It's quite inspiring. And I want to remind everyone that there is a question and answer box that you can write your questions. We will have time after the next speaker for your questions for Dr. Hervé and also for Manjula Stickler. And with that, I would like to welcome Manjula and turn the microphone over to you.
But thank you very much for that very kind invitation. And also, Dr. Hervé, thank you very, very much. That was very, very insightful, and I'd like to contact you even further, maybe a bit follow-up in terms of some of the data you've got there, because I'd like to share it with my colleagues. But welcome, everybody, and thank you so much for dialing in. You know, when people dial in to listen to what we're doing at the DHB, I feel very proud, but I also feel very, very honoured. But the other part of it is I feel that you are so special out there, special in a way that you care. And in the time when we need care and kindness and a little bit of thought and innovation, this is the time. And I hope that these sessions will help you, guide you, motivate you, and inspire you to grow and learn and flourish in your areas as well. So, look, thank you again. So the title of my presentation is Managing Sustainable Procurement in Times of COVID. And when that polling came up, I actually voted for the third one, which is boosted. Our sustainability program was boosted, and procurement, particularly because COVID has revealed some ugly truths about our own capacity and capability, but more importantly, what it does is it's actually put the spotlight on sustainable procurement and healthcare. So hence the reason I actually voted for that. New Zealand has a population of 5 million, and 5 million people. We've got 20 district health boards scattered all over New Zealand. Auckland is located in the top part of the North Island, and we serve a catchment of 531,000. It's also it's a secondary and a tertiary hospital, meaning that we provide tertiary services and specialist services. For example, we've got the Children's Starship National Service, organ transplant, cardiac surgery as well, and also specific some cancer treatment in there as well. We are also a teaching hospital, and we're also a very large employer of 11,000 staff. We have 1,000 inpatient beds. We also have another 500 for day surgery and outpatient treatment. We treat about we have 1 million patient contacts annually, and we are one of the fastest growing DHBs in New Zealand, and also the 10th largest hospital in the world. Our annual budget is New Zealand dollars 2.4 billion. Our clinical supplies budget is approximately New Zealand dollars 300 million. That's excluding pharmaceuticals. We have 17,000 product SKUs, which is the stock keeping units. That's items just in the clinical, and we have 1,800 suppliers. 90% of our goods are imported. Next slide, please. Our sustainable procurement program is actually driven by the government through its procurement framework. And they ask us to adopt the 4 broad outcomes, which is improving the New Zealand workers' conditions, which is around health and safety, equity, diversity, hours of work, harassment, pay equity or pay parity, and also wellbeing. There's a key driver within the government to have a health and wellbeing budget. I think this year's been the first year this government has introduced a wellbeing budget, and that's to look at our wellbeing as a nation. Hence, the drivers for procurement will look at these broad outcomes around businesses accessing government procurement, building our capacity and capability within our domestic construction sector, and this is also relevant to replacing our ageing health sector infrastructure. Many of the health buildings across New Zealand are more than maybe 40 years old and very, very poor functioning units and poor performing in terms of energy and definitely past the use by date. The fourth broader outcome, which is relevant to our discussion today, is environmental, which is to support the transition to a zero emissions economy and significantly reduce waste. These key focus areas is actually to open up competition and giving all local businesses a chance to participate and giving them enough time to respond to opportunities to properly and also help in line New Zealand in terms of procurement practice with international best practice, encourage more strategic procurement approaches, and also foster competition and innovation that will result in our broader environmental outcomes, which is the environmental, social, cultural, and economic. Our sustainable procurement policy at Auckland District Health Board features the 4 pillars: economic, environmental, social, and cultural. And I'm just going to talk about cultural for a few minutes here because that is a very strong theme that across all of the health sector, public health sector, and that's our Treaty of Waitangi responsibilities and acknowledging the Maori, the Indigenous people. and the importance of kaitiaki tanganga role and the spiritual links within the environment that strengthens our partnership to improve the health and environmental outcomes for Māori. Therefore, our Māori partners have a very deep understanding of their environment, therefore working together with them to help achieve their aspirations to be more unified in reducing the barriers and equities for Māori and reducing the impact of climate change. So we work with Māori as partners to create better outcomes for Māori and as well protecting the environment for future generations. That is a very, very strong focus within the Māori population, that we restore the environment to what it was 100 years ago. So our council drives that as well. So we align with these 4 key pillars in terms of how we approach sustainable procurement. Oh, I wanted to, maybe this is a bit early in this discussion, but I just wanted to reflect what partnerships and collaboration look like for this organisation. And this is just a small sample of organisations that work with us. As partners, we collaborate together. They are external partners and as well as internal partners. They are suppliers, they are universities, they are academics, they are local agencies, they are ministries, they are also organisations not even related to health, for instance, animal health, which is really interesting because, and forest and bird. Now you wonder, why are these agencies working with Auckland District Health Board? Well, it's actually research, innovation, and also sharing information. It is very important to understand the impact we have on our environment, not on just the land, but the air and the water. So we work with everybody, we share information, we ask them to share their resources and bring together much more of an understanding of what we need to do in the broader context and the strategic pathway that we would need to follow to build capacity and capability and resilience within the organisation to take it forward for the next 20 years. So what does sustainable procurement mean to us? It's a commitment. It is driven by our leadership, our senior leadership team from the top down. Our board is very, very focused and very committed to this. As I mentioned earlier, they're very committed to the Māori values and culture and kaitiaki-tanga and stewardship. That is a very strong theme that runs across all of our discussions. We also have a bottom-up approach. We encourage green teams to drive the culture and change and create the change to make things happen. Communication, collaboration, partnerships, as I mentioned earlier. We work with anyone and everybody to progress our sustainable procurement program, because there are many, many moving parts to this, and from small items such as syringes to large ticket items such as machinery, clinical equipment, to beds, to air vents and infrastructure items. So innovation, creativity is a very, very big thing within the organisation that is encouraged. We'd also support staff and promote learning to enable them to lead, grow and flourish, and leaving no one behind, which is basically the principles of adopting the UN goals, and to promote health and well-being. I want to talk a few minutes about our market tender criteria. And this came about 2 years ago. We were working with one of our partners, the Sustainable Business Network, and 2018 they provided us, working with them and a number of external businesses, they put together a question bank for sustainable procurement. And so back in 2018 we started the first tender document around sustainability. Now the questions does differ depending on the type of product that you're procuring. So this particular case study, we've got 2 case studies that I'll talk to, where we ask the tenders, the applicants to look at the to submit evidence of accreditation, products of the lifespan of products, how they deal with waste, the types of the disposal methods, the types of materials they use, and transportation, and also labour rights, human rights in terms of labour conditions, their safety records, and the equipment they use. And these are two case studies. The first case study was our first trial back in 2018, and this was a simple maintenance contract, external ground maintenance contracts. And this particular case study, we asked the applicant to demonstrate their environmental and principles by way of policy programs, what they did for staff in terms of their wellbeing program, their health and safety record, and their criteria for the case study number 1 was 8%. And that was where we were just actually trying to ensure that we captured everything. But what we realised is that we could use a lot of the criteria that was actually sitting in sector expectations and past performance and the technical skills that they held. So pricing on the case study number 1 was actually a minor consideration in comparison to the environmental considerations. Case study number 2, we decided that we wanted to really delve deeper into sustainable practice within the organisation. So we split the criteria between price and non-price. A non-price representing 60% and the price section representing 4%. Out of the non-price section, we increased the sustainability criteria to 15%. And we delved a bit deeper into this, and interesting enough, the successful tenderer actually scored the highest on non-price, including sustainability. Now, that successful tenderer had adopted this this United Nations Sustainable Development Goals. They had very strong policies in managing staff health and wellbeing. They demonstrated corporate social responsibility. They also had very strong connections in their community and were engaged. And they also actually demonstrated waste conversion strategies that that really scored very highly compared to the other applicants. Now, that was case study 1 and 2. Since then, for all items that are where the expenditure is less than 100,000, we've gone back on these case studies and actually ramped up the sustainability criteria even further by asking tenderers to submit products that basically are either compostable or have an end life, meaning can be reused or reprocessed in another way. So that's been a challenge for us. But as I said earlier, this is a journey with many moving parts. So what are the challenges for us? The challenges during the COVID has been the changing priorities. We were going along very well with Sustainable Procurement, and then COVID happened. So all our focus was, the organisation was focused on patient care and PPE. And as a result, our waste volumes did actually increase quite significantly over the last 6 months as a result of this. But also, what it revealed is some gaps in our capability and our systems and processes. So, and what we've done since March, April, there's been a separate work group that's been set up to look at sustainable procurement in a much broader sense, and also developing systems, and also looking at undertaking a risk assessment of our sustainable supply chain. Where does sustainability sit in this? Well, all future tenders will look at how we adopt new practices and provide, and also encourage innovation amongst suppliers. Visibility, I talked about some of our gaps, is traceability, authentication, also visibility and consistent standards. And this is part of the learning for us, is understanding more about visibility and standards, also monitoring that as well on a regular basis. and hence our systems, we don't actually have the systems to manage this at the front end. So we need to do a further work around this, and this is going to take time. But the Healthcare Without Procurement guideline is actually an excellent tool for us to move that along. One of the problems we've had is also lowest price model, and that's a problem for us because we feel that there's going to be some cost on adopting a much more sustainable option and through innovation. So that is one of our challenges and also one of our barriers, because our organisations are really cash-strapped and there's some financial constraints around that. The other challenge is meeting the Paris 1.5 degree warming. So if we are looking at sustainable procurement and greenhouse gases, we would want to know whether the organisation that we are procuring to understands the 1.5 degree warming and also working towards reducing emissions. That brings me to our own buyer-supplier maturity. We don't believe we are that mature in sustainable procurement, and nor is the supplier. When we need to work with them, collaborate with them, partner with them to go along on this journey. And with so many thousands of items, it is a long game. This is not going to occur over the next 18 months or 2 years. This change happens over the next 5 or 10 years as we build systems and internal capability and capacity. The other challenge is that we have very little local solutions. New Zealand is a great importer, but for healthcare, 90% of our goods are imported, which is a major issue when we have pandemics. Therefore, we can't actually look to local solutions and become the customer of choice. Our systems and processes to monitor compliance, as I mentioned earlier, we really haven't thought about what is a new system going to look like in order to really drive sustainable procurement. We've also got ageing infrastructure. So what are our opportunities? Opportunities is for all organisations to actually have their emissions certified. For example, Auckland DHB certifies its emissions under the Totu and EnviroCare. We believe that this is actually the way that forward for all hospitals to understand their baseline and footprint. And that's also including procurement. So we are actually undertaking a carbon modelling exercise to include procurement in our total emissions under Scope 3, which is non-mandatory. And this is highly recommended because procurement is expected to increase our emission footprint quite considerably based on the new NHS, which has procurement as being nearly 61% of its total emissions. The other opportunity is local downstream supply chain, again, fostering local solutions and investing in local options and local businesses. Self-assessment. This is something that's highly recommended. This is driven by our central agency, Ministry for Business, Innovation and Employment. Last year they asked all the public sector agencies to do a self-assessment on their procurement capability. Now this is an excellent tool. It is on the website under procurement capability. That really assesses not only your own capability but also the ability to manage sustainable procurement from the tenderer's point of view. This feeds back into the government's wellbeing budget as well in terms of how do we grow the New Zealand economy post-COVID. Building capability. Even our supply chain and our procurement agencies accept that the knowledge to build, to understand sustainable procurement, it needs to be developed further. And we are doing that using the Healthcare Without Harm guidelines. That is a really effective tool for us to move our journey along. Innovation, the 4 industrial revolution technologies. big data, analytics, artificial intelligence, virtual reality. This is innovation from both the buyer and supplier end. And that could also be, you know, investing in new systems or blockchain, for example. Also, the opportunities of what are the co-benefits. So we're saying that sustainable procurement should provide some co-benefits in reducing emissions, air pollution, going to green technology, transport, and also reducing the amount of waste that goes to landfill, because we don't have incineration in New Zealand and all our waste goes to landfill. So last slide is really just saying sustainable because everyone's responsibility. And this means that we need to get everybody on board. We need everybody singing from the same page. We need everybody actually accepting the fact that we need to do this to protect our people and protect our planet. And we've got enough capability, we've got highly educated workforce who are engaged, and so what we want to do is provide them with the opportunities to lead discussions, lead initiatives, and also be innovative, to speak at seminars, speak at forums, to showcase their own work, write up the evaluations, and put their name to papers, because this is the way we promote and inspire others to also lead. It is not my role to do it for everybody. My role is really just to facilitate and lead the charge and inspire others to take up the cause. It is a huge organisation with conflicting agendas as well. So there's a huge challenge for me. How do I spread myself across the organisation? And this one voice doesn't always get through to everybody on the ground. So it's important to grow your champions, grow your green teams, and also work together with your executives and set up a steering group. And each steering group could have its own subset in terms of infrastructure, procurement, energy, waste, and all of it's coming together, because it has to come together through the procurement arm, because everything we do has to be a procurement chain part of it. We are part of it. Every piece is a link to another piece. So we must close that chain and make it a loop so everybody's involved, everybody knows and understands the reasons why we're doing what we're doing, and also enhancing their understanding through education and sharing knowledge. It is the only way that we can learn and grow this and move along on the sustainable procurement pathway. Thank you.
Thank you very much, Manjula Stickler. We have a number of questions that have come in. We do have time for a few questions, and before we go to questions, we're going to do a poll of all the participants. So you will see in the chat box on your screen 2 questions that have appeared that you have a choice. Number 1, to what extent has the impact of COVID-19 on the supply chain contributed to your sustainability efforts? A, click on A if it has set back those efforts. B, if there's no change. Or C, if in your experience COVID has boosted your sustainability efforts. And the second question, in addition to cost and savings, what are the key factors influencing sustainable procurement in your healthcare settings? And you can click on the circle next to the question, and when you have answered the question, press the submit button at the bottom. Go ahead. We'll give you a minute to do this, and then we will display the results. We can see the results of the poll. 50% of you said that COVID-19 pandemic has set back your sustainability efforts, and some of you, 14%, indicated it has boosted. And for the most part, half of you say that it is demand and availability in addition to cost that influences your procurement. Half say patient and occupation, and all of the above is the most common answer. I will begin to give our speakers the opportunity to think about the questions. We have many questions that have come in, starting with Dr. Akash. You spoke about the number of initiatives on climate, health, and integrating sustainable procurement to promote this agenda. Are there standards that have been developed or included in the climate change strategy on sustainable procurement, which other countries may adapt and learn from your experiences?
Okay. So when we had some series of meetings with some experts to understand what these principles were about in the Indian public health standards, there are specialized organizations which deal with setting up the healthcare systems in the country, which comprises of architects and building experts and others, who explained as what the possible components which could be taken care of in the principles. I have only an requirement at a very just to overlook the entire process. So giving a lot of details of what goes in that is not what I can provide an answer to, but a lot of focus that goes into the principles is about the alternative energies and the energies conservation, which was one of the most important part of the discussion that was held. And Mr. Pankaj Bector was also trying to explain in his presentation how we at our own institutions at the same time were also taking a lot of efforts to switch from CFL to LED. So in a country like India, which is a very largely a rural country, and electrification was a big challenge for a very long time to get electrification to the last villages of the country. And electricity has always been a very expensive affair. Electrification has been an expensive affair, and then also it has a huge carbon footprint. So when the process was on, a lot of healthcare centers which are still struggling to find themselves with electrification. The idea was to ensure that we find energy resources like solar panels and alternatives that consume in an environment-friendly manner like LED lighting, which provide more energy efficiencies in context of light. So that was one of the important principles I remember on which there were a lot of discussions of how they will be taken care of in context of the new buildings that we'll be putting up in times to come, and how is it the possibilities of retrofitting the ones that have been held. An experiment was held in the state of Chhattisgarh, wherein in the last few years, when this Ministry of Alternative and Renewable Energy was trying to work to put forward in the climate change policy this principle of utilization of alternative energy, that we from the healthcare sector in the state of Chhattisgarh tried to establish those principles for all the primary healthcare centers of the state of Chhattisgarh. And it turned out as a very successful project that all the primary healthcare centers of the rural state of Chhattisgarh were electrified through solar energy systems and had LEDs instead of CFLs and other non-efficient electrical means. And looking into the success that came out from that pilot that was worked out in that one particular state, it was quite comfortable to understand that it is achievable, it is possible to do, and it is what it will be entrusted as one of the standing principles, and that we make a change in that. Many other principles were also been discussed in the Indian Public Health Standards, which also includes matters related to water efficiencies, we are having depleting groundwater sources now, and it's trying to find mannerisms in which that can be achieved is also a concern that have been addressed. So there, in the same light, there are a few others. I will not be in a position right now to tell more on them, but these are the few which I clearly remember during the discussion that I was able to oversee as the important principles that were discussed.
Thank you very much. I do think there are many examples from India that other participants on this call will benefit from and perhaps be able to adapt to replicate. And a reminder that the slide on the screen is about the upcoming webinars on the training program for the Sustainable Procurement Guide. And on the website that you see, greenhospitals.net, within case studies, there are case examples of these energy efficiency measures and implementation of solar. Beth, there is a question for you about the guide itself. The question is, the guide has included tools for making environmental demands. Does it include similar tools for making social and economic sustainability demands?
And that's a really good question. Some of those resources we are in development with, we are actually working with one of our members to consider and utilize and actually share some of their work, and that's to be developed in terms of the social area. And the economic side, we have created what we refer to as the Greenhealth Cost of Ownership Calculator that is freely available to all. So it enables you to assess the total cost of ownership and compare like products in order to determine which one would offer you the most savings. And it looks at the total cost from not just the purchase price, but the use cost and the end of use cost as well. And it gives you a framework with which to assess those products. So I think the social side is more in development, but the economic side, we do have resources available. Good question.
Thanks, Beth. And I would add that Healthcare Without Harm, together with the UN Development Program, UNDP, through the Sustainable Health in Procurement Program, is developing an index for the use of supply chain leaders, procurement officers, as well as suppliers that includes economic, social, and environmental aspects within the ratings of products and of suppliers. For Charlotta, there's a number of questions that maybe after this session we could send to you if you would be able to respond, and we can share with the participants. But I will pick two of them. What are the sectors and products within health systems that you would advise other healthcare systems to start with in substitution based on your CHEMI or the Stockholm phase-out list and national policies that you're aware of?
Oh, okay, yeah, that's a good question. You could, what do you say? You could either start with trying to exchange, for example, the products that you know are very close in contact with the patient, in like plastics that you actually put into the body. That could be one angle of trying to reduce. And then also another one could be that exchange the ones where you know that there are alternatives on the market. And I could also, if I'm going to mail some answers to use those, and I could also include a link because we do have the phase-out list in English. It's translated.
Which was another question, Ms. Brass, what the tools and resources that have been developed by Region Stockholm to integrate sustainability that may be available to this audience, if you would share a web link.
Yes, that's the phase-out list, and then also this monitoring report that I mentioned from 18 and 19. And these are the tools that we have in English so far.
Great, thanks very much. And a question for Mr. Pankaj Bector. You were already talking about the strategies around the COVID-19 pandemic, and it has proven, no doubt, that traditional strategies like robustness, flexibility, redundant capacity, surplus inventory are necessary but not sufficient to cope with this type of global pandemic. What would be key strategies at the policy level that can contribute to sustainable supply chain resilience and logistics?
Thank you, Susan. In fact, that's a very appropriate and the relevant question that building resilience as proposed in the supply chain. We all know that nobody has just thought of this very pandemic COVID-19, but there are 2-3 things what I felt that it needs to be addressed to. There is a geographical, I will not name the country, geographical location in the world where the things have started. And like API and other things in Indian market were coming from that very source only. So since the source for API and all the surgicals, all the face masks, the triple layer, N95, most of the items, around 60-70% of the items were having the same source of that very particular geographical location from where the supplies were coming. The raw material was coming. So that was the reason that it has really become tough during the COVID-19 situation for the manufacturers to go ahead with the production over there. Then our honorable PM has given a suggestion of Atmanirbhar or self-reliance. So that was the reason that government e-market has been put in place, and they have also put efforts for new startups and from globalization to go localization sort of a thing. But then I sum up with 2-3 things that from the regionalizing supply chain, we should have suppliers from the local manufacturing units. Rather than concentrating the supplier and the manufacturing at one place, it should be spread out. It should be decentralized. It should be de-regionalization of the items. That is, the next thing is the hedging and diversification strategies. That we should not over-concentrate raw material and supply chain in too few countries or too few places. Then it becomes tough. Because since a particular geographical located country has become where the COVID-19 has really been started from there, and then all the surgicals, all the drugs, all the APIs were there from that very place only. And the other countries, despite having good manufacturing units, they couldn't produce triple layer, N95, PPE, etc. So I think for the resilience, what is really being important is that I've also read somewhere that there must be a system of flexible manufacturing. I don't know how appropriate it is for medical products, but it is true that Shanghai GM Automobile Company has quickly resigned, and it has started the production of face masks. And similarly, the Ferrari has also started the manufacturing of face masks. So I will not say that this flexibility to be there in the government, in the medical products, but I think there is a need that we should have, rather than concentrating on one place, we should have more locations, geographical locations, where we can have the alternatives available, and also the different locations rather than concentrating at one place. Hope that I was able to address to the query. Thank you.
Thank you very much for Dr. Hervé. And there's a great deal of interest among the listeners about your work in reducing plastics, what you've learned that others may be able to replicate in their health centers, including what is the cost difference between plastics and the bioplastics, the cassava, pillow, starch bag that you showed us.
Okay, Susan?
Yes, go ahead.
Yes, can I answer?
Yes, please.
Yes, as you can see at the picture of my slide, there is a number 9 slide, that cassava bag is made from the cassava starch. And then it is different with the plastic because it's the end of its use. It will consume by microorganism, and then it can decompose by itself for about 6 months. And then if can be dissolved in a hot water also. So maybe it is the plus point of the cassava bag is about that it in the end of its use, it will not pollute the environment like the plastic, because the plastic, even it's in disposal waste, it still can create about 9% of carbon footprint. But for the cassava bag itself, it will be consumed by microorganisms, or it will not pollute it later like a plastic. But maybe this is also the become a weakness of this cassava bag, because it can dissolve in a hot water. So maybe the storage must be in a cool place, because when it is contact with a hot water, it will be dissolved slowly. So even this is our next project, still need a case study also how it will be implemented in our clinic as our next project of sustainable procurement, because the action, the activity should be on our planning action. But I think the idea of reducing the plastic use is positive to be declared by our clinic as a healthcare sectors. Like that, Susan.
Thank you very much, and a reminder to all the listeners that there is a Learn More section. We heard from Majula about the fact that there's no incineration in New Zealand, and within the Learn More section of the procurement guide, you will see examples of treatment technologies for waste management. There is questions that have come in for you next, Manjula, a bit about how it is that you've been able to influence the leadership in the health districts as well as within your suppliers to go along on this journey with you, and what did it take? And a related question is, do you think you can ask suppliers to improve both and short and long-term issues with products and services?
Look, if you're starting this journey, it isn't easy, and it takes persistence, perseverance. But you've got to have a really good ethical heart. You've got to demonstrate your integrity and also your passion, that this is not about you. This is about the wider picture, the broader picture, the future picture, and how the organisation must start to adapt. It needs resilience. And executive buy-in takes time. And we were very, very fortunate indeed to have our Chief Financial Officer actually sponsor the program. And it was only 2 days a week. And then we ramped it up to 5 days a week. So it needs to be a full-time role. In fact, I work probably 7 days a week. So it's a huge step to actually get the commitment from executive. But once you've got the commitment, and also setting out that strategy is really important, but also engaging with your community. Now, your community are key. They're key to ensuring that you've got your support. And this engaging with your suppliers, and it really takes time. So one of the things that we've done is we've got our suppliers to fund the pilots. This is Bector's and J&J and BD and various other organisations to fund the pilots that we can divert the waste, to fund the pilots to bring in new products that we can test, like potato starch drug trays, you know, and they like to work with us because we provide them with the integrity and ethics that go with hand in hand with health. And this takes time though, but once you've got one or two suppliers working with you and then they realise that you're evaluating a pilot that can be published, then for them it means their brand. It's enhancing their brand, enhancing their commitment to sustainability. So it sort of it folds over and it becomes a sort of a snowball that more and more organisations want to be part of you, holding regular forums and getting them to speak, coming in to do a webinar, speaking about what their products are doing and where the innovation is going. It's really important. And being part of the business, getting into the, and speaking to the nurses, the doctors, going into theatres, spending a day in theatres is a really quite a unique experience. And all of this helps, you know, doing site visits to organic farms and non-organic farms and testing out equipment on industrial sites and bringing others along. You don't go alone. I really very rarely go alone. I take the doctors, I take nurses, I take non-clinical staff, anybody who's got the time and capacity to come along with me. And I take photos. And then I put them up and show people that this is the way we're going to do things. Because this is not just my lone voice, it's everybody's voices and putting everybody up there and getting them to lead. So
and your voice and your enthusiasm certainly is attracting the energy to you and to the program. There's another question, and we're running out of time. I'm going to ask the last question of Dr. Hervé. It's a combination question. The first part is, does the procurement policy for healthcare in Indonesia affect your work in proceeding and either supporting or inhibiting? And you spoke, Dr. Hervé, about moving from the linear to the circular economy in the context of COVID-19, and you were talking about the reusable gowns. These measures, did they ensure the supply of PPE during the difficult times? And what, if any, were the challenges that you faced in acceptance with staff in terms of infection prevention and occupational health?
Yes. Okay, I will try to answer both of that question, Susan. Actually, about the procurement policy, we have a regulation based from Ministry of Health and also from the Ministry of Environmental and Forestry about healthy environment and also about green building hospital. But Chaya Kabu Clinic, our clinic, as a private sector or non-government healthcare sectors, it is allowed to make its own elaborations about the concept of the green healthcare sectors or healthy environment. Because I felt that green hospital paradigm is Indonesia still need to be drive more for establish further as a new focus of healthcare paradigm. So, but the policy itself so far related with our sustainable procurement project, like we said about reusable PPE. For the reusable PPE, of course, we still have produce a waste in the end of its use. And then as a primary healthcare sectors, we are not already have our own waste treatment. So the regulation of the government facilitate us with a three-party collaborations. So The one is the healthcare sector itself. The second is the waste transporter. And then the third is the common biomedical waste disposal and treatment. So this kind of collaboration is very useful even to process our waste to make sure that we already in line with the government policy, and then we already ensured by that biomedical waste disposal and treatment because we got feedback certificate that our waste is being processed well and treatment in there. And then, but for procurement details of products, maybe I still need to elaborate more information because so far as I know, there was not established at Indonesian report. It has been being a detailed procurement policy, what kind of products like that. But we can see in the Eckl label product in Indonesia that is being served by government in the web or media social about eco-labeled product that has been established in Indonesia. Like that, maybe for the first question, Susan. And then for the second, about the reusable PPE also. So actually, the idea of reusable PPE is come from that first how to make a changing the linear into a circular. And but the challenge is how to choose right reusable PPE actually for a third level standard of PPE. As we know, in the pandemic, in the first months of the pandemic, the imported PPE that coming into Indonesia, the price is very expensive. And it is difficult to us as a primary healthcare to reach that price. So the government make the regulation that local manufacturer can produce many of PPE, but the local manufacturer of PPE, because is that the amount is very many in every PP, so the Ministry of Health is making a regulation that it must be a standard for a reusable PPE, especially for a coverall suit. What kind of coverall suit that can be provided by healthcare sector. So why that we have to choose and we have to classify the coverall PPE, reusable coverall PPE that has the license of Ministry of Health, because there are so many also coverall PPE that has not given the standard by the Ministry of Health. There is maybe the situation about reusable PPE, and also about the in our clinic there is no facilitate about isolation COVID-19 patients. So in our clinic, we do a triage department that we classified which one patient that can stay for our later examination and which one can stay or which one should be referred to the hospital. So, so far with the reusable gown, reusable PPE that we choose, we has already made PCR diagnostic examination to our staff, especially the frontline, and then the result, the PCR test is good. for our staff. They stayed in a good and health condition. So far, we are decided that these reusable gown and reusable PPE that have been chosen by our clinic can be forwarded on furtherly. Like that, Susan.
Thank you very much, and we look forward to the case study about the plastics from cassava and more information about the implementation of sustainable procurement. I would like to thank you all again for joining us today, for your attention. You can see on the slide, those of you who are not already members of the Global Green and Healthy Hospitals, you can find information about how to join on the website greenhospitals.net, as well as more information about the Sustainable Procurement in Healthcare Guide.